Hi, my name is Elizabeth Stanley, and today we will be discussing Huntington's chorea. Chorea means abnormal involuntary movements. I will be discussing how Huntington's was understood in the late 19th century and how it's understood today. We will compare the symptoms and prognosis of patients in 1872 to the patients of the 21st century. We will also discuss the treatments used to relieve symptoms in the past and present. And lastly, genetic testing. Before 1872, chorea was thought to be a neurodegenerative disease. This is about the only thing doctors had right. They believe it affected the young more than the old, girls more than boys, and the darker the complexion a person had, the more at risk they were. Also, there was a thought that there may be lesions on the cerebellum that might be the cause. Dr. George Huntington, who the disease is named after, was a rookie physician in 1872. He was the first physician to accurately document the description of this chorea. When asked why he chose this disease to write about, he replied, "It was out of medical curiosity." Dr. Huntington described this chorea as a movement disorder where the patient suffered from dementia, psychiatric disturbances, personality changes, and suicidal tendencies. He believed this chorea was inherited and that it only affected adults. Also, that there was no cure available. Here are some quotes taken from Dr. Huntington's paper. If you'd like to pause the video and read them, you are welcome to. Here he discusses why he believed this chorea was inherited, some of the mental disorders that patients suffered from, and that he did not find any evidence of a cure. Dr. Huntington observed this chorea to be inherited because if a person lived to be about the age of 40 without showing any symptoms, then there was no way to pass this on to their children. The actual cause was still unknown because there was no consistent abnormalities found on autopsy. I found this quote from Dr. Huntington's paper. And here we must leave the interesting subject of the pathology of this disease and trust that the science, which has accomplished such wonders, through the never-tiring devotion of its votaries, may yet overturn and overturn and overturn it until it's laid open to the light of day. Dr. Huntington believed the best treatment for his patients was to not allow the patients to get mentally or physically excited. Agitated bowels were believed to be a culprit when a patient went into mental or physical fits. Like Hippocrates, a diet of simple foods and exercise were believed to help keep the patients calm. When the patient was having a severe mental or physical episode, as a last resort, the patient was given opium or chloroform until it passed. Electrical shock was also delivered to the patient to help in these times of crisis. However, Dr. Huntington stated that this should never be delivered to an extremity that was exhibiting symptoms because it usually made the symptoms worse. The outlook for the patient in 1872 was not good. Dr. Huntington stated that this chorea is a terminal illness with no cure and little to no way to relieve the symptoms. Patients were often placed in hospitals to live out the rest of their lives because they require 24-hour-a-day care. Also, hospitals allowed people to hide away their family members from society. Dr. Huntington's description in 1872 was very accurate. The only other symptoms added since then are difficulty swallowing, weight loss, and difficult to understand speech. Genetic testing has confirmed Dr. Huntington's suspicion of heredity. If one parent is positive, there is a 50-50 chance per pregnancy of passing it on. One thing Dr. Huntington did not get right is that there are cases of juvenile Huntington's chorea, although these are very rare. As the disease progresses, the patient's chorea increases in quantity and intensity. This burns a lot of calories, so it becomes harder and harder for the patient to eat and swallow. So proper nutrition remains to be a big part of the patient's treatment. There are programs today at the state and local levels to aid the patients financially, and there are a multitude of therapies that exist for the patient and also for their family members. These include occupational, physical, speech, cognitive. There's also psychiatric therapies because of the high suicide rate. Medications help relieve symptoms. However, there is nothing available to slow the progression of the disease. Research is ongoing to find better and better treatments. Unfortunately, the prognosis of today is that there still is no cure. It is still a terminal disease. Death usually occurs 10 to 25 years after onset of symptoms. And sadly, with juvenile Huntington disease, it's usually less than 10 years. Like I said, there are medications out there to help with symptoms. And a few patients are able to stay at home when they reach the end stage. But because of the round-clock care needed, most patients are placed in an assisted living facility. With genetic testing, a patient does not have to wait for symptoms to appear to confirm if they have Huntington's chorea or not. It actually can be found out almost as soon as conception. Society today is not very aware of Huntington's chorea. There are only about 30,000 Americans with this disease, and very few have ever heard of it. Even in the medical community, there is little known outside of neurologists and genetic counselors. However, support groups are growing for patients and their families living with this disease. Genetic testing. Why or why not? There are many more reasons to get genetic testing or not to. Here are just a few. Basically, what it comes down to, the positive of getting tested is the knowledge to plan ahead, financially, with your family members, etc. However, the cons are much more emotional. When it comes down to it, it is a personal choice that has to be made by the patient. Family members may have a strong opinion one way or the other, but the patient has to decide for themselves how they want to live the rest of their lives with or without this information. As Dr. Huntington asked in his paper, when will we see the light of day? There is still a very long road ahead in research and ultimately finding a cure. Sadly, we have not come along very far since 1872. But with medical technology changing before our eyes, maybe the dawn is closer than we think. For more information about Huntington's chorea, you can visit Huntington's Disease Society of America at hdsa.org. Thank you.